You are now watching Face to Face, live from the CSL studio. Your host, Nesta Cann.
Good night and welcome to another episode of Face to Face. Yours truly, Nesta Cann. And today we have a special guest in the studio, a good friend of mine from long time.
Yeah.
Goes by the name of JJ. What's going on, brother?
What's going on, man? What's going on? How's everything?
Everything is great. Like I was telling you earlier, man, is, through social media, they said social media can be the gift and a curse, but it could be a great tool and, to keep up with a lot of people you haven't seen in a while. I haven't seen you in 20 years.
It feels like it.
It feels like it. But I've been seeing you do a lot of great things, man. I've been keeping up with you. What's new?
Everything, right? Currently, recently just got promoted as new position, director of the Family Nurse Practitioner Program over at LIU Brooklyn for the School of Nursing.
That's nice.
Just started a business called Premium Health Depot, really trying to address a lot of the issues that underserved, underprivileged people like us, where we come from, still live in.
Yeah.
Issues that they face, trying to address those issues and really erase them and reverse them. So I've been busy, but being busy is a good thing.
Okay, tell us more about the health care for nurses and how did you get involved in that?
Okay, in general or a specific one?
Anything in general.
Crazy thing is, I got involved with nursing. My dad was a nurse,
yeah.
Right, and I actually had no intention of being a nurse, and I was actually at his job one day.
Yeah,
and
this is before high school.
This is before high school, maybe freshman year.
Okay.
Somewhere around there. No, I'm lying. No. This is like 6th, 7th grade.
Because I'm wondering how you went to Cloud Barton.
Yeah, this is about 7th grade. 5th or 7th grade, maybe.
Okay.
Yeah, 5th or 7th grade, somewhere around there. And I'm at his job, and a nurse comes on the floor, and she's like, "Dumper." And all the nurses get up and take off from the nurses unit, right? And me, I'm from Brownsville Project. So when you with a group of people and one person start running, we all gonna start running. Right? So, and we're gonna find out while we was running when the first person stops running. Right. We get to a patient's room, they stop running, I'm watching them, they pulling up IVs, they're pumping on the patient's heart, like they're pushing medications, they're doing a bunch of things.
Right.
And I just became enamored, right? Like, and I just fell in love with it, and I was like, Dad, whatever you do, I need to do this. You need to show me the exact framework of how you got from where you were at before to here. And I did it, and I ended up becoming a critical care nurse for about a year. Then I decided I can't do this. I didn't want to be in the hospital no more. Ended up leaving, went back, got my master's, came home, and this is when Obama just took office. Right, like he took office in the fall of 2008 into spring of 2009. I graduated in 2009. So we was in a bit of a recession then, and was looking for jobs, and I had been doing visiting nursing, and ended up stumbling in community nursing and doing house calls, and it ended up being a blessing. Like I've been doing house calls since 2010, which led me to go back to get my doctorate, which also led me to becoming an expert in what we call home-based primary care and an expert in transitional care. Yeah. So when patients get out the hospital, trying to make sure they don't end up back in the hospital.
Right. So you went to Cloud Barton High School, and after Cloud Barton, where did you go?
Went to Binghamton University.
Binghamton?
Yes.
And after that, you got your master's and all that stuff.
I got my master's from Binghamton as well, and then I got my doctorate years later from the University of Miami.
Oh, you went to the U?
Yeah.
Get out of here.
Well, I always wanted to play football. I wanted to play football for the U.
Yeah.
Growing up, when I was playing for the Skyhawks, that was my dream school to go to.
Yeah,
and
the U.
When I decided, I wasn't going to play football no more, went with nursing. So when it came time to get the doctorate, I was like, you know what? I could. Like, Binghamton was prestigious for nursing. They was prestigious for my master's. I was like, I go anywhere for my doctorate. I got the background of the bachelor's and the master's. I get to choose now, and end up figuring out that Miami was an even better nursing school.
Oh, really?
Yeah.
Wow.
They're number one in research in the state of Florida. They're ranked.
I thought Duke was up there. Duke is up there too?
Duke is up there too.
Okay.
Duke is definitely up there.
Yeah.
But Duke is probably top 10. Miami's probably top 25 to top 35 in the country.
Okay.
So for me, it ended up being a blessing going there. I didn't know what I was getting into, but it was a blessing.
Nice. So tell us more about, we were talking about it just now, the premium home.
Premium Health Depot. It's a company I created, and the reason I created it is because I've realized that working as a nurse practitioner for other people, right? and I've been in as an NP working full time. I've worked for 2 different companies, one for 7, 8 years, and another one for under a year.
Right.
Right. And I've one was a blessing, one was a curse.
Yeah.
Right. But within both of them, what I realize is that the kind of things I want to do within my community, I need to be in charge of it, or somebody that looks like me that comes from where I come from needs to be in charge of it.
Yeah.
Right. Like they are very big on giving back into their community, making sure their community is well and better, and they were okay with helping out in other communities that they serve. Right. And there's a difference between helping out and making sure you're changing something in another community.
Right.
So for me, for the communities that I come from, the Brownsville, Bed-Stuy, Flatbush, Crown Heights, right, the Bushwicks, these Brownsvilles, and it's mirror neighborhoods in different neighborhoods, right? Like Brownsville can mirror Soundview in the Bronx, right? And it can mirror Far Rockaway in Queens. It's the same thing, right? But so if you come from one of them, you come from all of them. Right. So there's certain things I want to see changed in those neighborhoods, right? Like there's like our neighborhoods having the largest number of killings, our neighborhoods having the largest numbers of hypertension, cancer, all this other stuff that can be prevented, that can be treated, right? When you talk about the HIV epidemic that ripped through the black community and still hits the black community, you talk about what are we going to do about that, right? Other people, they're coming to get their money out the neighborhood and they're leaving. Right? Like they're just making money off of healthcare, right? Which is, there's millions to be made off of healthcare. But it takes somebody that's from that community to say, nah, I'm going to change this. I want to implement these programs in this neighborhood that's going to last for a long time, that's going to change certain things. Right. So that's what Premium Health Depot is the start of, right? Providing premium health to those people who was told that they didn't deserve that kind of health. Right. You're going to get whatever kind of healthcare you got because this is only resources that's left for you. No, the best of the best, this is what I'm trying to provide for people.
And how's that going so far? Is it going pretty good?
I just started it.
Just started?
I literally just started.
I saw the logo on Instagram. I like it. It's dope.
Thank you. And mind you, it took me over a year just to get the company started, meaning to get permission to start it.
Oh,
right.
Wow.
So there's a LLC, which is limited liability company, which a lot of people have.
Right.
And then when you have a professional degree, it's a professional limited liability company. Okay. So before you have to apply to the education department, so they can give you a letter to give to the State Department that says he's really who he say he is. Yes. His license is good. Both of them, he can practice under this.
Right.
And then the state. And the education department told me that they'll get back to me within 4 weeks saying that my name is okay.
Okay.
It took them 12 weeks to tell me you can't use this word within the name of your company.
Oh, wow.
So I resubmitted it, right? I'm waiting another 4 weeks. It took them 16 weeks to tell me, nah, PLLC has to go at the end of your company. Then it took them another 17 weeks to tell me, oh, you know what? This company name is A-OK. You can have it now. And then I had to go to the State Department that I had to publish.
Do you think they did that to discourage you a little bit? No. Or they're just trying to make sure everything is like, make sure another company wasn't, or they just had to dot their I's and cross their T's, basically, to make sure that everything was good?
No, what it is they're completely underworked as the state, as the education department. They're
got you.
Underworked, right? But don't get me wrong. In healthcare, I've been in a lot of discriminatory situations.
Okay.
Right? Like, I've been down that path. So if it's that path, I'm going to call it like I see it, and I'm going to be completely honest with you. This wasn't one of them.
It wasn't one of those?
This is just, they're completely understaffed.
All right. Tell us about this clinical director for opioid. You do something as well like about that, too? You was telling me about that. Tell us more about that.
So that's I'm the clinical director for opioid overdose prevention program. Yeah. Right. And like people like to say that we're in a opioid overdose crisis epidemic now.
Right.
We've been in one. It was called crack cocaine. Yeah. Right. And it ripped through Black and Latino communities, and instead of treating people, they sent us to jail. Mm-hmm. Right. For large football numbers compared to regular cocaine. Right. So now that we're in this one, and this one is hitting middle America, suburbia, right? So now their idea is we need to treat people now instead of sending them to jail. They don't want to send people to jail that look like them. Yeah. So with that being said, it's also affecting communities of color, right? So being that this is affecting people that I look like, right? It's one of those, like, you have to take care of home. Right. Like, you can be a healthcare provider and take care of anybody, but you also got to take care of home. Right. And although that it may be something that whites lead the way in terms of overdosing, unfortunately, Blacks and Latinos are steadily climbing. right? So one of the things we decided to do as within my chapter of the National Black Nursing Association was we need to get involved in this. So instead of just being trained to give one dose of Narcan, which helps prevent opioid overdosing, we became a center that can train other people, right? We're already nurse practitioners. We already learn about it in our schooling. Why not train other people in our local communities, right? So we go around to communities that have levels that's either equal to or higher than, either equal to or higher than the New York City average.
Yeah.
So the Bed-Stuy, Bushwicks, in the Bronx, you have very high levels as well. So you, the South Bronx, Kingsbridge, Fordham Heights, it's another one I'm not thinking of, Far Rockaway. So these are neighborhoods that we're targeting to actually go into the communities and do trainings with people.
Oh, okay.
So that if you see opioid overdose happening, you're trained to give Narcan, right? And what a lot of people don't know is that if you push Narcan and the person actually is not suffering from an opioid overdose, nothing's really going to happen to the person.
Oh, wow.
Right? Like, so it's a win-win in pushing it if you think somebody is having an overdose. Whereas if they are actually having an overdose, you're going to save their life, right? Because you can push that, you get away. So and there's other things that you become educated that you can teach people about. One of the reasons why people didn't want to be taught about Narcan, right? So during the crack cocaine epidemic, one of the laws that's still out now that needs to be changed and taken rid of is kind of like a guilty by association law. Meaning, if you and I are together and you decide, you know what, I'm gonna shoot up, right? And I'm like, nah, I'm not with it. I'm not shooting up. But you shoot up and you pass out and you're dying, and I call 911. When they come, if you die, I get charged with your death.
Really?
Yeah.
Why did you do that? What's the thing? What's the story behind? I never knew that. Good thing, we have people like you to.
So it helps increase the incarceration rate, brother.
Oh,
right?
wow.
Like you have crack cocaine doing this, but then there's also this belief that if somebody dies, somebody has to be accountable for their death, right? Meaning, like, so I give you an example. You heard the unfortunate story of a police officer was shot and killed. I think it was like borderline Brooklyn, Queens, in a T-Mobile store.
I heard about it a couple of weeks ago, right? Yeah.
So, the perp ended up, I think he had a fake gun or didn't have a gun on him. However, the perp didn't shoot no shots. Yeah. Right? The cop was shot by friendly fire from other police officers that was coming. Right. Right? The perp is being charged with that police officer's murder, even though he never pulled the trigger. Wow. Right? So it's a thing within law that somebody has to be held responsible, especially when it comes to deaths. Wow. Right. So if you were shooting up and I was just in the area, I'm going to jail with you. If it was a group of us and one of us passed out, right, from shooting up and the cops came, like, we all getting locked up. It doesn't matter that it was just you. We all getting locked up. Somebody had to be held accountable. So the Good Samaritan law says that under this now, if you shoot up and I call the cops, I can't be held accountable for it. Right. I can't be held accountable as long as I have less than a certain amount of drugs on me. Right, and there's other intricacies to the law, but pretty much that's one of the things they try to put in it to help encourage people to now call for 911, because this is some of the reasons why people are overdosing. They were using together or using around people, and they start passing out. And if you know you're going to get charged with their death,
call 911.
They're like, I'm out. Like I'm not calling nobody. I'm not doing that. I'm out. And people were dying because of this.
That's crazy. Yeah, you could possibly save life by calling 911, but now people are getting scared. Like, wow, if I call, yes.
So one of the things with the opioid overdosing prevention is that they also put in the Good Samaritan law to try to protect some of those people.
Yeah. Now I see on social media you're doing a great job with the motivational speaking and all that great stuff. Great job. What are some of the things that you go around talking to people about? Some of the topics. You discussed some of them already.
You talk about healthcare. I also talk to people about just career planning in general.
Let's talk about you said about black men and their health.
Yes. So it's for black men, we lead statistics when it comes to having poor health. Yeah. Right. Like people with the most heart attacks, black men. Right. People with most uncontrolled cholesterol tend to be black men. We rank high up there. People with diabetes, black men rank high up there, right? And black men also have a huge distrust of the healthcare system, right, as they should, right? And that's one of the reasons. That's one of the things people don't understand. Like, you pass things down to your children, generation to generation, generation. Right. And one of the things we pass down is the mistrust of healthcare workers, which we should, right? There's this thing called the Tuskegee experiment. Yeah. We're in Tuskegee, Alabama. They were doing an experiment on black men about syphilis. So two things was going on. One, they were giving some of the black men syphilis without them knowing. Like they were injecting them with syphilis because they wanted to study it.
Right.
Now, it sounds immorally wrong already, which it is. The other huge issue with this is that during this trial, they found a cure to syphilis. The way research works is that if you're testing something to try to find a cure or that's something that can improve people's lives, the moment you find it, you cut the research off, right? Like you've proven your point.
Right.
You're supposed to start giving it to people. They kept going on with the trials.
Yeah.
Right? Even though they had a cure. So, and this is just one of many things that happen like that to people of color, including black men. So we have this huge mistrust. So one of the things I try talking to them about is we need to, even if you're going to go see a provider that looks like you because you feel more comfortable, you need to go see a provider, right? If you don't need to see somebody that looks like you to feel more comfortable, right? Like go see somebody, right? Like if your chest's been hurting, if you've been having difficulty breathing, right? Like if you've been eating food and you feel like you're still full, you can't eat or you can't digest your foods, go see somebody, right? You're starting to have blurred vision, you're starting to have tingly feeling, go see somebody, right? It helps prevent things, right? It helps prevent you from getting on medication. It helps prevent long-term complications like being on dialysis, having a heart attack, open heart surgery, all these different things that you can do. So I like to talk to men about that because as black men, we need to take control of our health.
Yeah. How about eating-wise?
Eating as well, right?
Eating as well.
One of the problems you end up finding is that as healthcare providers, meaning as nurses, nurse practitioners, as medical doctors, physician assistants, whatever it is, the people who you go to seek for help, a lot of times will tell you, you need to eat healthy, right?
Right.
But if you turn around and ask us, what does that mean, right? Like if I tell you as somebody who doesn't know anything about healthcare and I tell you, eat less than 1,800 calories because you have diabetes.
Right.
You're going to look at me like, what the hell does that mean, right? Like if I, like so often when I'm teaching my students and I tell them, tell me what 1,800 calories look like. They have no idea.
Right.
Right. It's because we don't actually talk about this stuff.
Right.
Right. Like we've been so trained in what we call symptom-based, meaning something's wrong. How do we fix something's wrong?
Right.
Right. One of the things that the Affordable Care Act that Obama did was it pushed what we call prevention and health promotion, meaning we have to prevent this stuff. So healthy eating helps prevent things.
Right.
Right. So it's a huge thing, but we need to learn what we're telling people.
Right.
So now when I tell people like, oh, you could go to myplate.org, right, and it'll show you a plate and the kind of proportions you're supposed to eat. They're like, oh, okay. You know, when I tell them you need to exercise, before like, what does that mean, right? Like people were running every day, like I'm exercising, not losing any weight.
Yeah.
That's not necessarily what you're supposed to be doing, right? Like you can't go more than 2 days without inactivity, meaning without exercising. When you exercise, you need to exercise between 30 and 45 minutes a day. You need to do weight resistance is one of the key, whether that's weight resistant bands, whether that's weight, right? And that's the key, meaning if you're not going to do any other exercise, you need to be doing that.
Right.
A lot of providers don't know that, right? Like we just tell you, oh, you need to start working out. But if as a patient, if I tell you start working out and you work out and it doesn't work, you're not coming back to me.
Interesting. I didn't know that. Let's talk about the stigma that they have on black men in terms of black men, buying cars, not saving. Basically, we're not like investing like how the Jews, the Asians, and the white men are doing. And, we're just out there spending and balling. Do you hit on those topics as well?
So absolutely. I talk to them about that all the time, right? And one of the reasons I talk to them about that is because little black boys can't grow up to be what they can't see.
Right.
Right. That's the saying that I live and die by.
Right.
Right. And one of the things I say is, one of the things that gang members and drug dealers do very well, it's be there for the kids in the community. Right. Whether they're being there for them in a bad way or a good way. Right. They be there. Right. Like they can see them every day. They wake up, they see them, they can identify them. Right. Right. There's no doctors walking through their neighborhoods. There's no lawyers walking through their neighborhoods. Right? Like there's none of that. Right. Nobody there to show them. And because we come with this idea of having money, right? Like meaning like we want to have money. That's the dream. Right. Get out the hood, right? Like how you get out the hood, you got to have money, right? What does having money look like? And you know what they think having money looks like? They look at the rich people that are on TV. Yeah. Right? Like most middle income families aren't on TV. It's very rich people. And a lot of times it's very flashy rich people. So this is what they're seeing. This is what it means to make it. Like if I get money, I got to buy a car. Because even if I'm still living in a hood, I want to feel like I'm not living in a hood. Right? Even if that's just a temporary dream, I want to feel that way. So I often talk to them about it. and tell them, you got to understand, like it's bigger than just trying to appeal like you got out of the hood, right? You need to save, you need to do things. So like when I start talking to them, like people ask me, you gonna get a clinic now that you have your premium Home Depot? And I'm like, no, not yet. I'm working out of home as my office as first, right? Like I'm doing house calls, I'm doing other things. If I got to see somebody, I'll see them into my house. And be like, why? I'm like, I'm not renting a place. When I get a clinic, it's going to be because I own the building. I put the clinic in one of the floors on the building. Right. And then I'm seeing people out of that, and they're like, "Why?" And I'm like, "Because I'm buying property. I'm not just doing healthcare." Yeah. Right. Like you have to teach them how to start dreaming bigger. And after I teach them how to dream bigger, I teach them how to do things like make a 5-year plan. Right. Like if you're in high school, what do you want? You want to be in college? So you want to be in college in 5 years. So in 4 years, that means you need to graduate high school. So that means within 3 years, that means you have to have taken your SATs, you need to pass all these classes. So then in 2 years, you need to do this. And then 1 year, which is right now, you need to get on your grind to do this. And they're like, oh, this makes sense, right? Yeah. Like you have to show them things that make sense.
Yeah. Most of your audience there, what is the age range for the audience that you talk to?
A lot of times when I do talks, it's career panel, so school-age children. It can be anywhere from kindergarten all the way up to college students.
Yeah, that's good. That's where you got to get them too, right there.
Yeah, absolutely. And I'm like I tell people all the time, I won't get out of bed to work extra, like to go see patients, to make money, like when I'm not feeling like it. I'll get out of bed any time of the day to go talk to students, right? Like my daughter was in the hospital with pneumonia, right?
Oh,
like
wow.
I called out of work. Both jobs told them, I'm not working, I'm not doing anything. I had an engagement to speak with high school kids, and I left the hospital. The only time I left the hospital to go talk to the high school kids and come back. Yeah. Right? And the high school kids was astonished, like, your daughter's in a hospital with pneumonia? Like, why are you here? Right? Like, and I showed them the pictures and all, like, she has oxygen on, everything. I'm like, because children are the future, right? Like, y'all are our future.
Right.
And this may be the only time you see somebody that looks like you, that came from where you came from.
Yeah.
Right? Like I'm letting you know, like I'm flesh of your flesh, blood of your blood. I came from the same neighborhoods you came from. I stood on the same corners you stood from. I went to the same schools you went to. Right? Like, and I'm here now doing this. So you can see it. Right? For a lot of my kids that I coach football with, I'm one of the only people they've ever met that has a Benz that doesn't sell drugs. That's huge for them. Right? Because when they first saw it, they was like, Coach, you sell drugs? Right? Because in their mind, that's the association they have. Everybody that has that car that looks like me does this.
Does that, yeah.
Right? Like, because the other people, the hundreds of thousands of us that don't sell drugs that have this car don't necessarily come to the neighborhoods. Right? We don't drive in the neighborhoods, get out. So now that they see me with it, they're like, so I don't have to do this to get this.
To get that.
No, you don't.
Yeah, I know. Let's talk about football. I was going to get into that. You teach football, right?
Yeah, I coach football.
You coach football.
Yes.
Okay.
Yes. I coach football. I love football. So
I thought different because high school, you're basketball.
So the crazy thing is, football is my first love. So I was actually playing football and basketball. So even that year when we took Barton to the playoffs for the first time in over 20 years, I was playing football as well.
Okay.
Right. So I've
well, not at Barton.
No,
yeah, because we didn't have Barton.
I played with a team called Brooklyn Skyhawks. They've been around since 1977.
Yeah.
But I started playing with them from 1995 to 2000. So I grew up in the Skyhawk organization.
Okay.
Right, and I had a bunch of offers to leave Barton to go to other schools. Like I had a scholarship offer from Poly Prep, from Christ the King. August Martin wanted me to come. Sheepshed, Canarsie. And a lot of my friends that I played with went on to these schools, but I wanted to do nursing. But I ended up going back down to the football field in 2012, and one of my boys that I played with, he was a couple of years older than me, and like he always looked out for me when I played, right? Like he's 3 years older than me. He was coaching, right? And he's coaching defense, and you walk down a football field, we got a saying like, once a Skyhawk, always a Skyhawk.
Yeah.
So like I go on the field, I'm watching the kids practice, and like I start helping them, right? Like I just started assisting. Like, you can always tell when the old Skyhawk's on the field because he's just helping out, right?
Right.
And my boy's like, yo, I need help with the defense. Why don't you come out and coach with me? I was like, cool, I'll be back. When's the next practice? It's like Friday. All right, I'll be there Friday. I came Friday, came back Saturday, game on Sunday, and haven't left since, right? Wow. And like this is year number 8 for me.
Wow.
Right? Like we've won 3 championships. We should have won an additional 2 championships. But
referees?
Nah.
Oh, okay.
I can't blame the refs. we played very good teams that, there's a team called the Springfield Rifles that we just lost to. They're pretty much our mirror image from Queens, right?
Oh.
They're in Southside Jamaica, Queens. We lost to them in double overtime, right?
Wow.
You get to that point. My kids, we just had we literally had a bad, in an entire 40 minutes of the game, we had a bad 7 minutes.
Which age group is this?
I coach 11 and 12.
11, 12,
so
okay.
we go from 6 to 17.
6 to
I
17.
coach 11 and 12-year-olds.
And you're a defensive coordinator?
Yeah, defensive coordinator.
You're pretty good at it?
Yeah.
You send a lot of blitzes?
It depends on what the game calls for, right? Like I might get into a blitz-heavy package against certain teams, and there's other teams where I may just play my front four, my front five guys, and I'll let them handle the business. It depends on how well I can handle them. But you always got to be willing to adjust.
Can you adjust to the offensive coordinator too and be a head coach if you had to?
If I had to, yeah, absolutely.
Yeah.
If I had to, but one of the beautiful things is that I don't have to, which is what I'm happy about, right? Like my head coach is the offensive coordinator currently.
Okay.
And we actually getting ready to get a new offensive coordinator. One of our staff members from our youngest units is moving up to our unit.
Oh, nice.
Right, but that's I'm really just about wherever I need to coach to make a difference. I'm good with. Like I don't have a problem with that.
Okay. Do you have your own charity foundation or anything like that?
No, I'm working on it.
You're working on it? Yeah, because I figure a man like you, I know definitely that's in the works too.
Working on a company. It's actually going to be called BMEN, Black Male Enrichment Network.
Mm-hmm.
Pretty much I want to create a network that men of color can have to use from the time when they're of children to beyond alumni of colleges.
Yeah.
Right. And before I was focusing only on, like junior high school, high schoolers, and I had somebody come to me and tell me like, listen, you need to do something with lower elementary. Like you need to start there. And I couldn't understand like why? Why do I need to start there? And they're like, this is the crazy thing. So when you take a standardized testing when you're in lower elementary, right? So the test that you take when you're in second grade, they predict how many jails they're going to build from the second grade year old test.
Wow.
Right? Like that's how crazy it is, right? I literally learned this the day of I graduated with my doctorate, right? Like it was like, oh, you need lower elementary. I'm like, for what? Like they determine the amount of jails they're going to build based on kids' second grade level of testing. And I was like, second grade?
Yeah.
Right? Like we're throwing children away from the second grade? Like, you know how crazy that sounds?
Yeah,
like, you know how much that can happen between second grade and 12th grade?
12th
like,
grade.
You're throwing kids away. Like, you're just predicting that these kids are going to need gelling. So how many gels are we going to build? Right? So, focusing on after-schooling program, career development, financial literacy, health. So, like, there's different heads to it. But the things I'm going to mainly focus on with that would be the health awareness and how to apply that. Financial literacy, which is huge, right? We need to teach children how to not even just save. How do you invest? What you invest in, what that look in, right? Also, I'm going to be big on athletics. I feel like a lot of our public schools have become this kind of dichotomy where you have to choose either between sports or you have to choose between education.
Yeah.
Right? And like when we grew up, like you can go to a school that was very good in sports and very good in education. Now a lot of the top educational schools don't have good athletic programs.
Yeah. I noticed that too because a lot of our schools, they don't have good athletic programs at all. You have to send your kids far away to some of these other schools, especially white schools, just to have those kind of, opportunities.
Absolutely.
It's crazy.
There's a lot of talent in New York.
Yeah.
Right? And whether people have always recognized our basketball talent.
Yeah.
Right? Like always. Right? So we haven't necessarily had to worry about it.
Yeah.
Right? Like what Tiny has done down at Lincoln High School has been phenomenal.
Right.
What he's done in talent. Right?
Yeah.
And even preceding when they went on that second one, starting with Sebastian Telfair.
Sebastian Telfair,
yeah. You remember Grady.
Grady.
In the whole world, right? Like
Yeah.
boys and girls being good. They've always recognized it.
Yeah.
In football, we've always had a lot of talent. We've always had to ship our talent off, though, right? Like Penn State has always come down and had to pick up a litter of our talent. That's when Canarsie was in their heydays.
Yeah.
And Syracuse came down and had to pick up their litters. There's just nobody here in New York.
Yeah.
And so we were starting to send out high school talent elsewhere. But now there's starting to be certain schools, and especially crazy thing is Erasmus football program runs things in New York City.
But didn't they break up Erasmus though?
Yeah, so Erasmus is a campus. So
campus,
they broke up your school into a bunch of small schools.
Small schools.
You get to keep your sports team overall.
Yeah.
Right? But the Erasmus coach, what he has done in terms of he has sent more kids to college on football scholarships than any other coach before him, right? Like he sends kids off to college on mass in mass, right? Like he had Urban Meyer coming to Brooklyn routinely to look at a kid that's in the he's in the NFL now. Curtis Samuel, he plays for the Panthers.
Okay.
Right. But there's been other kids that started to go to Ohio State. Other kids go different places. Right. And I'm in the first year of having the kids that I first coached in college on scholarship now.
Oh,
right.
wow.
Like, so that's been a big thing. Right. Like you see University of Miami, they have 2 kids from Christ the King and another kid from Poly Prep. Right. So like they're now starting. All these coaches are like, we're coming to New York for talent. Right. So we just have to do a good job now of keeping our talent. Right, and maturing and developing our talent. But then also we have to be cognizant of if I have a kid here that I could get to college on scholarship and his mother don't have to pay no bills, I need to work that, right? So like I can't just be a high school coach. I got to be a high school coach that has connections or is willing to connect with college coaches to get my kids exposed. Because at the end of the day, that's what it's really about. We can win championships. We can do everything. Getting our kids out of our neighborhoods into better schools so they can be educated so that they can then come back within our neighborhoods and make a difference.
Make a difference, yeah. So if you see a kid has talent, but you know he comes from a poor, family, you try to work with them.
Absolutely,
yeah.
Absolutely. I don't believe in throwing anybody away.
Yeah.
Right. And it's not just talk, right? But because I remember I did an interview for when I was getting my doctorate, I did an interview for a magazine down there called the Heartbeat, and they were like, they were asking me questions about my neighborhood, and I was like, where I come from, right? You don't come out of this neighborhood without either getting your hands dirty or having people who get their hands dirty for you, right? Like, that's just the reality of where we come from, right? Like, none of us are completely clean, right? Like, we have to clutch, crawl and scratch and to get our way out of certain stuff, right? Like, you have people, like, you have big brothers that protect you, right? Like, if you may not be in a gang, but the gang knows that, that kid's going to be going away to school. That kid's going to be a sports star. That kid's going to be whatever. He's getting out of here. Nobody touch him. Right? Like, you have people that do that. So I know that if a kid comes from a troubled neighborhood, right, like, he looks like us. He looks like me. He's going through what I went through. It's a lot to go through, right? Like, I may be trying to coach football. This kid may be worried about what he going to eat later on tonight. Right? Like, it's a difference of what they're going through, and, the system has been designed for us to fail all the time, over and over, right? And the crazy thing is you'll get a lot of people who will say, if my boy grew up in the same situation, he made it out that neighborhood, right? If he make it out, anybody can make it out.
Right.
And my response to that is, if there's 100 kids and 5 of them made it out the situation, that's a problem. If I gave you 5%, if you did 5% on exam, you would fail miserably. Right? Like, if this was college or anything else, if you don't get a 70 or above, you failing. Right? Like, you getting an F. So don't tell me that 2 people out of 100 made it out, right? Or 10 people out of 100 never got in trouble, so therefore the other 90 can do it. That's not how it works.
Right.
Like, if I was doing a drug that cured 10 of the 100 people that it treated, would you want that drug? Right? Like,
yeah.
You know what I'm saying? Like, don't say that. So we can't be out here throwing away anybody. Right? Especially people that look like you, that come from where you come from. You can't make it and then say, nah, you don't got your stuff together. I don't want to deal with you. You can't do that.
Yeah. Last but not least, man, moving forward, 2019, what are some of the biggest things you're trying to tackle? Some of your biggest plans for 2019?
So 2019 is...
And moving forward, not just 2019, but moving forward.
So 2019 moving forward is the beginning of my journey to create health equity. Right? And also erase generational disparities.
Yeah.
Right, and so Premium Health Depot, Family Health NP, PLLC, starting that up, seeing patients, helping that grow. Hoping that by the beginning of the 3rd quarter, I'll be seeing patients full time. By the end of the 4th quarter of this year, so December, I'll be looking to expand, hiring other nurse practitioners, PAs, MDs, with drivers and scheduling, expanding out into different health insurance companies. Also have a company, Dr. Nurses, that I'm doing with my partner, Britt.
That's what I was going to ask you. Is it just you, or do you have a team behind
That's
you?
it. So Premium Health Depot is me.
Okay.
Dr. Nurses is me and my road dog, Dr. Brittany Price. She's we call her Dr. Nurse LA. She does correctional health.
Okay.
NP in California, in a correctional facility. She also does like a lot of traveling, and she's touched every continent.
Wow.
Like she's a phenomenal woman. So that's her and I, like getting that off the ground to educate the world on what doctorally prepared nurses do. Because you hear the term doctor nurse, and you're like, what? Like that's an oxymoron.
Yeah.
Right. So we're letting you know, like, what do we do? Right. Like the different kind of doctorate degrees, which each doctorate degree does, what some of those people who fall within those doctorate degrees are doing now. Right. Like because we have phenomenal people that falls in that. Creating a network within those nurses that can talk and collaborate with each other, do different things, and then creating mentorship ladders for everybody who wants to be a future doctor nurse, right? Selling merchandise that goes along with it, doing consulting. Also have, I want to get B-Men off the ground before the end of the year. I also want to create another PLLC called Depot for Healthcare.
Yeah.
To help with some of the stuff, and then growing. I also do medical marijuana certification.
Oh, really?
For patients.
Oh, wow.
Educating people on. You have to be certified. Not all, probably less than 1% of providers are certified to prescribe medical marijuana. So I want to do that. I also want to open up a marijuana dispensary. Right.
It's not legal in it's only in certain states so far it's legal, right?
So it's in New York, recreational marijuana is not legal.
Okay.
Right? And the actual plant is not legal. But two of the products in the plant, the two main products in the plant, which is THC and CBD, are legal. So there's different kind of forms you could get them in, right? You get them in a vapor, you could get them in an oil to rub, you get them in a lotion. You could get them in different things, right? But I want to be positioned in the market for when it does become recreationally legal, right? And I also want to find a way that when it becomes recreational legal, I feel like I feel like people who hustle now, right, know exactly what the marijuana market would need to look like in the street, right, in our local neighborhoods, I should say. So one of my things is I want to be able to educate those people, right, and give them jobs,
right,
because you know exactly what this look like, right? Like you've been doing this illegal for a lot of time. Now that it's legal, you shouldn't be passed over for this opportunity. Right. You're like you have the most experience for this. Right. So let's get together.
Yeah.
Let's partner up. Right. Let's expand on the dispensary I have. If you want to create another one, let's partner up and create more and expand them in different neighborhoods. Right. And let's take care of Brooklyn.
Yeah,
right,
yeah.
Like Jay-Z said, right? Like, don't die over the neighborhood that your mama renting, right? Like, take your money and buy the neighborhood. So that's another thing that I'm trying to look to do. Eventually, want to also open up daycare centers. So I got a lot, and I also want to continue to, when I feel like I'm getting close to a dream, the dream starts running away and expanding, right? Like that's a big thing for me. Like every time I feel like I get close to a goal, I feel like I come up with other ideas. Like before I was content with just, let me get a clinic somewhere nicely situated and by myself. Even if I was renting it out, pay for it by myself. Now I'm like, no, I need the building, not the
thinking bigger,
right? Like, and I need other specialties in it, and I need to create it. Because now I'm like, I can serve Bedford-Stuyvesant, half of Bedford-Stuyvesant very well with this company, right? It's going to take another company to get into Bed-Stuy, not to mention Bushwick and Canarsie, Crown Heights, not to mention the other neighborhoods that look like us. Like I said, we have mirror neighborhoods all over, right? So the Bronx, the Queens, certain places in Manhattan. Like I want to create that kind of wealth within those, that kind of health within those communities.
Nice. Love the thing that I love everything you're doing, man. Keep it up.
You, man. Thank you for having me. I appreciate it.
But before we go, you have to let people know how to get in contact with you, social media, all that good stuff, websites and everything like that, man. So go ahead.
Okay, cool. Also, I'm sorry. One more thing. Me and my brother Trev, we also want to do a podcast talking about like certain issues that go on in the country,
right?
And given we want to provide like an educated expert opinion analysis on it from the Black male's perspective, right? So we want to provide that as well.
Okay.
But I'm sorry. So get in touch with me. On Instagram is JJ227, which is JYJAE 227. I'm also the Dr. Nurses, DR Nurses, Dr. Nurse New York, Dr. Nurse LA. That's for Instagram. That's for Twitter. I'm on LinkedIn as Dr. Julius Johnson, DNP. You can also find me at LIU Brooklyn. Everywhere. I'm trying to be everywhere. I really appreciate you having me on.
No, thanks, man. It's a pleasure. Great, Yo, before we go, anyone ever tell you look like Kyrie Irving a little bit?
I
just thought about it. I was like, wait a minute.
Listen, I be getting to places, headed to a hotel, and they're like, Kyrie Irving. And it just got to the point where I don't even respond and be like, listen, I'm not Kyrie Irving. I just be like,
yeah.
You know, they're like, where you going this year? Like,
well, thanks, JJ, for coming on the show. This wraps up another episode of Face to Face. Yours truly, Nesta Cann. Take care and God bless.
Appreciate it.